Okay, so today we're going to talk about a condition in the shoulder called a labral tear. So the labrum, it's hard because a lot of people don't know where it is, and so I'm just going to explain this really quickly. We're looking at the shoulder. This is that humerus bone coming down, and that humerus bone, it comes up into a socket. It's called the glenoid fossa, and it comes up into that socket, and if we peel away, like this is all the rotator cuff. The deltoid's not listed or showed here, but if we peel the deltoid away and we peel the rotator cuff away, you're gonna have a capsule or ligaments that support those two bones. If we peel those away, up into that joint, that socket is lined with like a piece of cartilage. It's called the labrum, and it essentially acts as like a shock absorber or a cushion to that joint. Okay, so how do people injure this? So think of, we call it a foosh. It's a fall on an outstretched hand. So think of like you're playing a sport, you're going up the stairs, you're running, whatever, and you fall and you trip and you go to brace yourself, and that shoulder kind of gets jolted, if you will. And so that humerus kind of comes up into the joint and it tears the labrum. That can happen a lot of different ways. Think of even like if you're skiing or in a motor vehicle accident or you're playing a sport, that can happen and it can even cause a dislocation. Sometimes a dislocation with a labral tear are pretty synonymous. They can happen together. There's another way too, it's not as common, but it's like a bicep eccentric loading. And all I mean by that is if I'm picking up like a heavy object and I'm putting a ton of strain on that bicep and that bicep tears, the bicep comes up into the joint and attaches to that labrum, and so if we put too much load on it, it can possibly tear or strain and pull the labrum and tear the labrum possibly. Okay, so what are the signs and symptoms of whether you have a labral tear or not? So you're going to have a lot of shoulder pain. You may know for sure if you have a dislocation, but if you don't have a dislocation associated with it, you're going to have a lot of pain, but it's going to be anterior or front, lateral, and posterior pain. So it's actually pretty generic pain. The common sign would be like you get clicking or popping or catching. That's a pretty common sign. And then usually like if you compress the joint, that's going to be really, really painful. But if you distract the joint, it actually feels good and it feels relieving. And this is a condition that actually the labrum gets poor blood supply. And so we get a little bit worried if we detect the labral tear because we want to do everything that we can to help this heal or to possibly avoid a surgery and start working on it soon because it gets poor blood supply. Okay, so how do we treat it? You are going to have a lot of weakness, right? As that labrum gets torn, every surrounding musculature, whether it's the scapular stabilizers, the rotator cuff, the deltoid, all of that's going to become weak. And so we've got to first start working on how do we start to stabilize that joint. We've got to stimulate blood flow. Again, that labrum gets pretty poor blood supply. And so what can we do to stimulate blood flow to help in the healing process? We do manual hands-on therapy. We use vibration therapy. We use modalities. We'll try to stimulate that blood flow. And then we've got to avoid any activity that's going to cause strain or compression to that joint. And physical therapy for something like this, again, take, kind of the thought of 6, 7, 8 weeks, we do physical therapy, we work on all these things. If you're still not better, you're still having pain, clicking, popping, then we go to an orthopedist. We do an MRI, we see how bad it is and determine if even a surgery is needed. The hope is PT will be enough to restore your range of motion, get your strength back, decrease your pain, and get you kind of back to that prior level to hopefully avoid a surgery. But it's something we see a lot and it's something that we can treat and help you with.